You know, there are some skills in medicine that you just can't learn from a textbook. You learn them late at night, in those quiet hospital rooms, under the hum of the lights. We're talking about the art of guiding a family through what is, without a doubt, one of the hardest decisions of their lives. This isn't just about knowing the science. It's about communication. It's about real empathy, and it's about bringing clarity into what feels like pure chaos.
So that's the big question, isn't it? As a resident, you're going to find yourself in this exact spot, probably when you're exhausted and feel totally unprepared. The monitor's beeping, the situation is getting worse, and a family is looking right at you, not just for answers, but for real guidance. So how do you do it? Let's break down an absolute masterclass in how to have this conversation. All right, picture the scene. It's a familiar one. It's late. The patient is 89 years old. She has advanced Alzheimer's, and her body is starting to shut down. Sitting right next door is her daughter, who's also her primary caregiver, and she is just exhausted and completely crushed by this incredible sense of guilt. This is the moment. This is that high-stakes environment where your words are going to matter more than pretty much any procedure you could possibly do.
Okay, this is the first and probably the most important thing you have to understand. For the family, this isn't some interesting case with a bunch of symptoms and lab results. This is their person. This one sentence from the daughter just cuts right to the emotional core of everything. She's pleading with you to see the human being in that bed, not just the medical problem you're trying to solve. And the physician's response here? It's perfect. He doesn't dismiss her emotion at all. He validates it, but he also gently and firmly establishes the reality of the situation. He's basically saying, I see your mother, and because I see her, I have to see the case clearly so I can help her. It's the perfect bridge between empathy and clinical responsibility. So how do you actually build that bridge? Well, the doctor in this story pivots. He moves away from that emotional back and forth and introduces a really simple but powerful framework. He's about to define the two paths forward, and he does it by stripping away all the confusing medical jargon to give them absolute clarity.
And I want you to pay attention to the language here. He doesn't say, acute renal failure secondary to hypovolemia. No, he says, dehydration is the perp. It's like a little detective analogy. And what that does is it makes the problem feel identifiable and way less terrifying. It turns this complex medical crisis into a single problem with a potential solution. A perp they can actually try to catch.
So first, he defines ordinary care. He calls it beat cop stuff. Fundamental, reasonable, the kind of thing you do every day. And he gives a really clear guiding principle. The benefit outweighs the cost. A little poke in the arm for an IV line is a small cost for the potential huge benefit of waking up, of having one more moment of connection. It's just the logical first step. Now, for the other side, the doctor is just unflinchingly honest. He doesn't sugarcoat it one bit. He uses these really stark, powerful words, brutal, and torture disguised as hope. He explains that CPR on a frail 89-year-old body is not what you see on TV. It's violent. He's not trying to scare the daughter. He's giving her the unvarnished truth about what that path actually looks and feels like. And when you see them side by side like this, wow, the distinction becomes crystal clear, right? On one side, you've got a reasonable attempt to fix a specific problem. On the other, you have a brutal intervention that might just prolong suffering. This kind of visual clarity is an absolute gift the physician gives to the family. It lets them make a decision that's informed, not one just based on fear or confusion. Okay, so a clear framework is the foundation. But to really make it hit home, to make it resonate, the doctor uses another incredibly powerful tool, analogy. He's about to translate all this abstract medical ethics stuff into really human terms that the family can actually feel and understand. This first analogy is a total game changer. It completely reframes the goal of what they're doing. Are we here on a rescue mission, trying to save a person who can come back to a meaningful life? Or are we just running a salvage operation, pulling parts from a wreck without any real hope of putting the person back together? It forces everyone in the room to ask, what is the actual purpose of what we're about to do? I mean, this is just beautiful. Who wouldn't give a hungry person a sandwich? This makes ordinary care feel so natural, so kind, so fundamentally right. It's the obvious, humane thing to do. It lines up the medical action perfectly with a basic act of compassion. Simple. And then the contrast he provides is just as powerful. The image here is visceral. It's not just unhelpful, it's actually harmful. It shows the whole concept of medical futility better than any lecture ever could. It shows that sometimes the most aggressive things we can do in medicine become a kind of violence against a body that's just trying to shut down naturally.
All right, here's where it gets really tough. Because even if you have the clearest framework and the best analogies in the world, there is still one massive barrier you have to get over, and that is guilt. This next part of the conversation, this is probably the most important therapeutic thing the doctor does. And there it is. The daughter says the one thing that every single family member in this position is terrified of. They feel like if they choose to stop aggressive treatment, they are the ones causing the death. It is a devastating, crushing burden. And as a resident, you have to be ready to hear that, and you have to be ready to address it head on.
And boom, there it is, the pivotal reframing. The doctor correctly points to the real cause of death, the disease itself. He makes the Alzheimer's the enemy, and then he totally recasts the daughter's role. She is not the executioner. She is the protector. Her job is not to make her mom live forever. It's to protect her from pain and from indignation at the very end. Think about how empowering that image is. She goes from being this passive, guilt-ridden person watching things happen to an active, powerful bodyguard. Her decision to say no is suddenly not an act of giving up. It's an act of fierce love and protection. It gives her agency and a truly noble purpose in what felt like a completely powerless situation. So with that huge emotional burden lifted, and with the daughter empowered in this new role, the very last step is to make a concrete plan. This is what moves the conversation from the abstract and the emotional to the practical and the actionable. And that provides just a tremendous sense of relief and control. The plan he lays out is so simple, it's humane, and it's time-limited. It honors that idea of ordinary care by giving the treatment a real chance to work. But it also sets very clear boundaries. It says, we will try, but we will not torture. For a family that's lost in all this uncertainty, this structure is a lifeline. It gives them a clear path forward for the next 24 hours. And this final image, it replaces that cold, scary idea of technology and machines with a profound act of love. The daughter's job isn't to fight a losing battle with ventilators and defibrillators. Her job is to provide comfort, to be present, and to just accompany her mother on the very last part of her journey. It is the ultimate act of being a protector, a bodyguard. And this is the doctor's final piece of advice. And it's not just for the daughter, it's for all of us. It's for you. Because after all the frameworks, all the analogies, all the reframing, it really comes down to this. This conversation is an art, not a science. It means you have to bring together everything you know clinically with your own human intuition. So as you face these moments in your career, remember these tools, for sure, but also remember to trust your gut. It often knows the difference between a rescue mission and a salvage operation.